This patient had a CT-KUB done for assessing the urinary tract, but we are not going to focus on that because we are going to learn something about the colon. All right. So this is a plain study. As you can see, there is no IV iodinated contrast administered. I want you to focus on these small, bright, dense structures. There's one over here. There's another over here. And another out here. There's a small one out here. Another one here. And there's a small one here. So essentially, this is not a bowel prepared for a bowel study. So it's just normal bowel content seen with air foci within. And when I point towards this structure, this is the large bowel. So in an axial CT slice, as we go craniocaudally, what we see on the right side is the ascending colon. All the way up, once we get towards the liver, we have the hepatic flexure. Then we have the transverse colon, and as we go across to this side, we have the splenic flexure, and then we come down as the descending colon, and further down we have the sigmoid colon, which goes into the rectum. So this is a case of small outpouchings that we see, which is typically described as diverticuli. Okay, quite often diverticulosis is asymptomatic. Only rarely when it does become symptomatic do we have complaints of abdominal pain, etc. So let's just quickly have a look at some of the key features. So colonic diverticulosis is sac-like protrusions of the colonic mucosa through the weak areas in the colonic wall, may be symptomatic or asymptomatic. It's seen more commonly in old age, so incidence rises after 60 years. It is more commonly seen in men and is associated with smoking and those with an elevated body mass index. So as you can see, the most common location of diverticuli are typically in the sigmoid colon, 70%, 10% to the ascending and the descending colon, and 5% in the transverse colon. The remaining 3 to 4% comes in the cecum. So the sigmoid colon is the most common site of diverticulosis and quite often presents with diverticulitis, inflammation of the outpouchings. As you can see, I've mentioned here Asians on the right side because the right-sided colon or the ascending colon is the one which is commonly afflicted in Asians, while in the Western population, the descending colon is more commonly affected.